My name is Alan Pickett, and I'm a mental health nurse with Pathways to Housing DC, and I'm a team member on what's called an assertive community treatment team for mental health consumers in the district. Alicia was born in Puerto Rico and lived and worked in various places in the United States doing a whole assortment of jobs, and clearly is someone who's taken pride in her work history and in her ability to work.
Okay, here we go.
When she became ill and began having difficulty with drinking and difficulty relating with her family well, she became sort of estranged, and where that eventually led her to was a multi-year history of, literal street homelessness in Georgetown under a bridge with a bunch of other people that kind of lived together as in a little enclave.
Island and Pathway, they helped me out because I was just spitting blood and nose running with blood. It was terrible.
Many of our folks, I think, went through years where they really weren't able to get what you and I would consider to be sort of appropriate and effective care for real and serious medical conditions. So the apartment sort of changes that around. The mere being able to receive that reminder call from your provider the day before an appointment, and then simply being able to have the sense of safety and order in your life that an apartment gives us affords them a huge leg up in terms of successfully getting better at managing their health care.
With no apartment, you can do nothing. I used to take a bath in the river. Sometimes you don't have much choice. But sometimes you just stuck. It's stuck.
Housing first is great, it's a wonderful model, but what about your health care, What about sustaining in the community? So there are other things that have somewhat been avoided, because priorities are trying to survive. So, health care, isn't a priority for many people in these, very challenging situations.
We don't have x-ray vision, so we can't look at each other and know that we're hurting inside. And I think it's probably true that many of us struggle with articulating when we're not doing well or need help. It's especially satisfying to be with someone while they learn how to get their own needs met and to do that more and more and more independently over time.
My patients give me more than I give them, because every day that I see them and I hear a story, I'm like, how do they do it? And I thought I was strong, just being, growing up in the city and, being this kid. And all I had to do was go to school and make good grades. And, but these people, surviving it's amazing. And they don't even realize how resilient they are. So they're inspiration in so many ways, and they have no idea.
They look at us like a real human beings, not all the people in the street. So it's good.